who should undergo testing for the PALB2 mutation. If you have a family history of ovarian or pancreatic cancer or had a diagnosis of breast cancer before age 45, talk with a genetic specialist. And there's an online support group on Facebook for those with the PALB2 mutation. It's called PALB2 Warriors. Dean.
Thank you, Dina. Next up, we are joined by Dr. Laura C. Farrington, a medical oncologist at Cancer Treatment Centers of America, Chicago. Doctor, welcome. Nice to have you here.
Thanks for having me.
Let's start off with some basics. What do people need to know to start off when we're discussing breast cancer?
Well, the statistics are quite alarming. 1 in 8 women will get breast cancer in their lifetime, but breast cancer can also occur in men. Detecting breast cancer early and getting advanced cancer treatment are the most important strategies to prevent death from breast cancer.
Early detection is what it's all about. So what are the risk factors that are involved?
Well, there are some things that may increase your risk of breast cancer. Things such as increased age, obesity, female gender, history of benign breast disease, smoking, heavy alcohol use, family history, and genetics may increase the risk of breast cancer.
So let's talk about some of the signs and symptoms that women and also men should be aware of.
Most breast cancer will come up as a new lump or mass in the breast, but there are other things that can be seen. Sometimes it's simply a skin change, things like red or flaky skin. Sometimes it can be dimpling of the skin or swelling of the skin. Sometimes it can be just nipple changes. You can get nipple inversion or nipple discharge. And sometimes we may not even notice something in the breast. Sometimes the first sign is actually a lymph node in the axilla or a swelling or mass in the armpit region.
So let's talk about diagnosis and treatment options. Where do we start with that?
Well, there have been huge leaps forward in breast cancer treatment in the last decade. There are a lot of things that we have now that have never been available in the past. Things like advanced genomic testing, which can help us to target someone's particular cancer with a particular targeted therapy. It also allows us to not give treatments to people that don't need them. It can actually spare a lot of women chemotherapy. Other leaps forward that we've had are in things like surgery. We're doing a lot more breast conserving surgery, but even in mastectomies, our breast reconstructive options are much more than they ever were before.
How about some final thoughts as we wrap things up?
Well, there are so many stories of men and women who are breast cancer survivors and thriving. The most important part is early diagnosis and treatment. I have patients that are young women who have had breast cancer and have gone on to beat breast cancer and have healthy babies.
Thank you so much, Dr. Laura C. Farrington.